I went to Malawi. I was working with kids who have HIV.
I went to a small high-altitude city in Peru. I was working with the Maternal Child Health Project.
Whether it's an emergency situation or a stable one, the practicum's a really great opportunity for students to get hands-on experience in a research area that they're interested in.
2 days before I arrived in Sierra Leone, the first case of Ebola was confirmed. I was essentially an intern with the International Rescue Committee and was originally going to Sierra Leone to work on a reproductive health project, but it was a very quick shift into working on Ebola. I was representing IRC on the Kenema District Task Force, which was comprised of the Ministry of Health, UNICEF, the WHO, and the World Food Program. At the beginning of the outbreak, many of the NGOs, including IRC, did not have specific funding for emergency response services. And so the British High Commissioners and the Irish Ambassador to Sierra Leone came out to Kenema, and I was asked to host them. It was kind of a surprise to be in an emergency response setting, and it was, yeah, a little scary. But I really couldn't have asked for a more intense and educational experience.
John is a perfect example of a typical Mailman student who wasn't surprised by any of the challenges that he faced. He was really well equipped to shift gears and ask the right questions and listen. Those combined skills really made him a perfect fit for that situation.
Dr. Moreski's absolutely brilliant. She's an emergency medicine physician. She's managing multiple programs internationally.
I started a program called Zehentner, looking at how to bridge the gap in acute care or emergency services in rural sub-Saharan Africa. Mailman is unique. We're constantly using the work we do in the field to inform our teaching. And a perfect example is El-Sadr. Wafa is a world-renowned infectious disease physician, the director of ICAP, and a great leader in global health.
Our students are given a lens through which to understand the world and develop public health solutions that is interdisciplinary, that goes from the science to practice and positions them to lead for the next 50 years of their career.